Thank you very much, Annie, and thank you for the opportunity. It's a real honour to present here with this panel of impressive women and with Drew, and I thank you very much for that opportunity. Before I begin, I want to acknowledge the traditional owners of the land on which we meet and acknowledge their ongoing dispossession and marginalisation. So I'm just going to give you a little bit of a quick snapshot of the Climate and Health Alliance and the work that we do. In a sense, our organisation is a campaign. It's born out of a sense that there's an important need to bring the health community into the climate change discussion, and that hitherto the voice of the health sector has not been loudly heard in relation to climate policy in this country and indeed internationally. And also out of the understanding that health professionals, health and medical professionals, are trusted and respected voices, and that their mobilisation and participation in this discussion can help influence communities' attitudes and understanding and willingness to participate as well. So this is our website. I encourage you to go and have a look. There's lots of resources there on climate change and health, links to important research and also materials from our campaigns. So we're a coalition of healthcare stakeholders representing lots of different disciplines, representing health professional groups, health research organisations, healthcare service providers, and individuals who are members of the Friends of Climate and Health Alliance. So our main kind of work is around raising awareness about the health impacts of climate change, but also about the health benefits of emissions reductions. And also we have an agenda around sustainable healthcare, so greening the healthcare sector. So not just about telling other people what we think they need to do in terms of policy. We're trying to bring about change in the healthcare sector itself and reduce the environmental footprint of the sector. We've got a campaign at the moment with one of our members, the Australian Research Alliance for Children and Youth, which is raising awareness about the implications for children from climate change. Children bear 80% of the disease burden from climate change, and the climate impacts mean that children can face a lifetime of compromise in terms of their health. So we've got significant individuals, respected people to become signatories and champions of that campaign, and we're lobbying the children's commissioners in each state and territory to prioritise climate change and its risks to children as part of their agenda. Another piece of work is looking at the economics of the health benefits of emissions reductions. So we've produced a report about what those are in terms of the international research, but we think it's a very important piece of work to understand what the economics are in Australia. So we're working with an econometrics firm who are going to do some modelling for us to produce a report on what the economics are around reducing emissions in Australia under a range of scenarios. So I think that'll be very exciting and important work. As I said, we've been working to engage the healthcare sector on climate, more specifically and more recently around health and energy policy and around coal and coal seam gas. So moving from a focus on climate change itself to the causes of climate change, and specifically around fossil fuels. And to that end, one of the things that we're doing is producing a video on with public health and environmental health experts talking about the implications for health and for climate from coal and coal seam gas. So we're filming that next week, and we hope that it will be out, if not next month, then certainly early in August. And as I said, the work in greening the sector. So we've been working with the Climate Commission to facilitate conversations with people in the healthcare sector around climate change. So we've been part of organising meetings in Victoria and New South Wales and Queensland at hospitals and health unions. So bringing more of the health community into that conversation. With one of our partners, the Australian Hospitals and Healthcare Association, who are a member, we've been running greening the healthcare sector think tanks. We've got another one coming up in Melbourne soon, and part of our work in doing that is promoting a tool for the healthcare sector which has been developed by our international partner Healthcare Without Harm, called the Global Green and Healthy Hospitals Agenda, which is a free tool that's available to all healthcare settings to help them become more sustainable, reduce their environmental footprint and contribute to public health by reducing the environmental and public health adverse impacts from healthcare. So getting the message out, sort of sharing our message in mainstream media and also in journals like Medical Journal of Australia is part of our work. We've been at the Sustainable Living Festival in Melbourne a couple of times. We had a panel this year, The Heat is On. That's our Climate and Health Alliance President, Liz Hanna, who's here today on a panel with Professor David Caroli, who's on our Expert Advisory Committee, and Tony Bartoni, who's the Vice President of the Australian Medical Association in Victoria. We also ran a Climate and Health Clinic for the second time. Bron Warhope, who's here in the audience, is key to pulling that together this year, and that provides an opportunity for community engagement and having direct conversations with people about what the opportunities are for improving their own and population health, from strategies to reduce emissions. Countering misinformation, we've tried to contribute to intervening in that debate in this particular instance around the health impacts of wind turbines and the misinformation that's been leading to public concern about wind farms in their community. We felt it was important to, as a group of health groups, as an alliance of health groups, to share what the health community understand to be the evidence around that. So our position statement on health and wind turbines is on our website, which is hopefully a useful resource for communities who are dealing with concerns. We're also not afraid to tackle some of the misinformation from our elected leaders. This piece on the conversation was written in response to the Health Minister in Victoria, David Davis, who took it upon himself to produce a brochure to say that the carbon tax would be harmful to health and would impact health services and the ability of people to get appointments with their GP because of the costs that it would impose on health services. So we wrote a fairly strongly worded article about how that was really counter to the interests of the health and well-being of constituents, and given the strong commitment to action on climate change from health and medical research institutions around the world and the advice of the World Health Organization, it was extraordinary that in a wealthy democracy like Australia that we would have a health minister taking that position and using taxpayer funds to produce a brochure to that effect. More recently, and I think some community climate groups have been using these questions to have conversations with their MPs. This is prompted by a blog by Donald Brown on climate ethics, which is encouraging people to consider whether or not our elected representatives have the freedom to exercise personal choice in terms of whether or not they accept the science of climate change, and as elected representatives with the ability to affect the health and well-being of millions and in fact billions of people around the world, that they have an ethical responsibility to respond to the scientific consensus from respected institutions. So we've put together a package of questions. There's actually 2 subsequent articles to this on the conversation, which is encouraging questions around whether or not markets are the most appropriate way to manage climate action, and I forget the third, but you can go and have a look. We recently had an event bringing health leaders together to talk about the health implications of energy policy. So this is a way of beginning a conversation in the health community to say, well, what are the health impacts of the choices that we're making about where we get our electricity and the choices that we make for energy. So we had a roundtable for health leaders in Canberra. This is the Chief Medical Officer of Australia who came along, and we hope is feeding that information that he learned at the roundtable into the various committees that he's involved in. This led to the development of a joint statement on behalf of, given that 2 of the signatories to this umbrella groups, to around 70 health groups signing a joint statement pointing to the risks from coal and coal seam gas and from fossil fuels on health, and has led to a commitment among those health groups to develop a joint position statement and then to campaign together with a campaign featuring health professionals calling for cleaner, healthier, safer energy systems. So part of creating that space of advocacy has led to the Australian Medical Association developing a position on coal seam gas, and following our round table, I was interested to see that their Public Health Committee had been sharing some of that joint statement, and that has led to them taking a stronger position on this issue. So some of our advocacy is having a sort of horizontal impact on other organisations in the sector, and we're pleased that that's occurring. And I think that the impact of health groups getting together and tackling the hard issues, certainly for this media publication, was considered to be fairly significant. Our uncashed dividend is a report that we've got here, which is bringing together the evidence about the health benefits of emissions reductions, and to help people kind of bring that positive messaging about what an opportunity it is to improve health and well-being from strategies to cut emissions. So this is produced as a tool not only for policymakers but also for activists and people who are campaigning to kind of help to understand what those opportunities are and to incorporate that into their messaging. It's certainly a very positive message. I mean, we've got an extraordinary amount of media. I should say that report was produced in partnership with the Climate Institute, so using an existing institution to kind of build their capital around understanding health as a frame for communicating about climate change. And as I said, very, very appealing message, obviously, in terms of media. We got hundreds of news stories published about that report the day that it came out, morning television, radio, so it's clearly a message that cuts through. We've also been involved in international advocacy, so involved in a global climate and health summit. In fact, incredibly, the first ever global climate and health summit just back in 2011, held in parallel with COP17 in Durban, and that was bringing the international health community together to encourage a more strategic approach to advocacy around climate and health. That's been very useful and led to us producing a statement at Doha the following year. Last UN COP meeting, the Doha Declaration on Climate, Health and Wellbeing. So building on the networks that were created in 2011 led to a statement that was signed by around 100 health and medical groups, I think from 30 countries, but representing literally millions of health professionals around the world. And that network is now working together to do some more advocacy on the World Health Organization, encouraging them to prioritise climate change and its risk to health. So what's next for us? Our election platform for this upcoming election is to say, well, where is our national plan for climate and health? If climate change is the biggest threat to global public health of the 21st century, as a wealthy industrialised nation, where is Australia's plan? Where is the national strategy to address that? Inside of that, we think it's important that we have a sustainable healthcare agency, so helping our health sector transition to a zero emissions or low emissions environment, and obviously placing an emphasis on the fact that reducing emissions is important in terms of protecting health and that there are opportunities to improve health. I've mentioned the other things that we've got coming up. And just to share with you one of the inspirations for what we hope, what will be our upcoming campaign, was a very successful campaign that was run in Ontario and to shut down coal-fired power in that province in Canada. I've spoken to people there, who, both from the health and environmental campaigns, who say that it was really when the health community stepped forward and became very visible in that campaign that sort of spelled the end for coal, and they will soon decommission their last coal-fired power station in Ontario. So we look forward with some positive anticipation about what we can achieve here when we start to mobilise health professionals in that way and those messages more widely. And part of that work will be part of a global strategy. I mentioned the global summit that we were involved in Durban. We partnered in that instance with Healthcare Without Harm, who are an international NGO. We now have a formal partnership with them, and we're very excited that we have been working together to develop a global strategy to mobilise the healthcare sector on coal through a process of engagement, education and research and collective advocacy. And there will be initiatives run, if this strategy is fully funded, which we anticipate that it will, in 5 countries, of which Australia will be part, and will be, the Climate and Health Alliance will be involved in running those initiatives here, along with people in South Africa, India and China. So there'll be a fantastic opportunity to run health campaigns, but also to run them concurrently and learn from people in the healthcare sector in those countries as we're doing it, to learn from one another about how to be most effective about doing that. So that's it. Thank you very much.